Hi, everybody. Miguel Dow here. I'm the president and CEO of Valer Systems. We do a lot of design and development of medical devices, wearables, IoT. And today I'm delighted to have as my guest Zach Lyon, the CEO and founder of H3Pelvic. We're just going to have a brief chat about a fantastic initiative that Zach has been working on that Valer has been able to contribute to. So, hi, Zach. Welcome.
Hey, Miguel, it's nice to be here today, and I really appreciate you recognizing what we're doing and taking the time to learn more. So let's
I
go.
love it. I love it. Yeah, we'll just keep it short and sweet, respectful of your time and our viewers' time as well. We do these occasionally with partners and customers and friends of the Valera ecosystem. So tell me a little bit about you and tell us a little bit about H3 Pelvic.
Uh, I'm a product designer of about 35 or 40 years. It's in my blood. I'm a person with lived experience. The product came to be through a very challenging personal issue I had, and resolving that situation and continuing to figure out if it works so well for me, what else does it work for? And that opened up a world of opportunities and discovery and a passion and the entrepreneurship to reach out to others who are suffering, and upon making their lives better, it's a momentum I can't stop with. So that's what's really set us off. Yeah.
And basically, so you are focused on pelvic pain and you have a neuromodulation way to address chronic pelvic pain. Is that how it works?
That's right. So, Miguel, there's a lot of interesting literature and science about what the human body does when we modulate from hypoxic to hyperoxic conditions.
Right.
Uh, I won't get into the deep science, it's all on the website. You can learn about it, but pretty amazing. And at a minimum, we're allowing people to have a different choice other than having to go to possibly surgeries they don't need.
Right.
Certainly opioids that they don't need, and a lot of medications that make people, um, you know, woozy, drowsy, can't sleep, aggravated, just in general, a lot of the side effects that come with those medications, we don't bring those. So, it's good all around. It's holistic, it's natural. And you didn't ask me where H3 comes from. It stands for human centric, holistic, and harmonic.
Oh,
So,
I love that. I was going to ask you, yeah, I wonder about the three H's there, but
sure.
it's so interesting, folks, because the way we met Zach was through a challenge that we put out there back in September of 2025. We are now in January of 26, called the Spark Design Challenge. So we invited different startups and even more established companies to participate with an exciting, innovative project that they might need some help with from a design, a development, electronics, hardware, firmware support, and we would offer up to $10,000 worth of engineering hours. And out of, gosh, I forget, 30, 35 competitors, folks who submitted entries into this Spark Design Challenge. Zach in H3 Pelvic was one of the two winners. And so we're delighted to be supporting H3 Pelvic initially with this design challenge award. And so tell us, Zach, what have we been working on in these early days between Valair and H3 Pelvic?
So, Miguel, as I've brought it to a certain level of, I won't call it completion, but we're getting well down the road, in understanding what my customers were going to expect. And when you consider human factors and usability and just general what your customer would come to expect, we needed to raise the bar and make it more intelligent, easier, friendlier to use, connected with our cell phones, maybe even connected through the internet to our clinicians, our physicians, and especially when it comes to doing clinical trials. So all that stuff needs very intelligently built connections, electric, digital, and communication connections that you guys specialize in. And so I'm really honored to be working with you guys on this very first phase to get there. And so far, so good.
Wonderful. Thank you so much. And
Mhm.
we're rooting for you. We're excited. You've shared with me in private. Maybe you can just hit on some of the milestones in terms of where do you go from here? You're now in a fundraising mode, but what do you expect will be your key milestones over the next 2, 3 years?
Mm. There's a lot of milestones. Um, the first milestone we've achieved, which is finishing our phase one grant, which is proof of the deep science and that our technology in the most extreme applications remains to be safe, does not harm any tissues, and that was a beautiful result. So from there, everything blossoms from that data. We need to get into clinical trials and build devices for clinical trials. That's Volar is key to helping us get that base system to allow us to do that. So the milestone would be first clinical trial, first
Right.
clinical indication that we choose. It's the lowest hanging the fruit, big market. Um, Getting that first FDA clearance opens up a world of opportunities, especially when it comes to prescribing a device off-label. And there's a million opportunities. So I would say first clinical trial, and yeah, I mean, and the first big investor that wants to be a part of this from a private perspective. And we're ready to talk to those people when they're ready. But in the meantime, we're hunting big bear in the non-dilutive space too. So it's all good.
It's all good, and perhaps we can help you as well. We have good
Sure.
connections in the angel and the VC world and CVC. Happy to introduce you to some folks there as well. But yeah, we want to keep it short and sweet. Zach, appreciate the collaboration, appreciate your time to sit down and do shoot this brief video with me as well. I'll make sure to include your link and include also some other materials, your slides, when we publish this video in our website or in our newsletter. And folks, if you know of anybody that might need help, like Zach did in terms of hardware, firmware, electronics, we've been around for 46 years in Silicon Valley, do a lot of motion control and power management and sensors and wireless connectivity, a lot of AI. Now physical AI is coming to become a very important element of medical devices and wearables and IoT device development as well. So feel free to reach out to us. But thank you so much for everybody's time. Thank you, Zach. And we'll see you at our next brief interview in our series of conversations with customers and partners. Take care.
Thank you, Miguel.
Thank you, Zach.
Appreciate it.